Hey guys, it's Matt with the EC, and today we're just going to talk a few minutes about Cardizem or Diltiazem. So this is a calcium channel blocker that we not only use, but it's pretty common. It's out and about, so patients use this all the time for some pretty common dysrhythmias. It's been around for a good bit. It was released in the market in the early 80s, so it's definitely been out long enough so that there are generics out there, so we're going to see it a good bit because of that too. So like I said, this is a calcium channel blocker, and it basically works by slowing down calcium from entering in the cell during that whole action potential phase. So this medication, we're going to see it has negative inotropic and chronotropic effects, meaning that once I have this medication, we're going to get kind of less squeeze and contraction from the heart. And we're also going to get a reduction in the rate. This is one of our true rate control meds. As a sort of a secondary side effect, it also affects the vessels too. This kind of works as a smooth muscle relaxer. However, this medication in particular, Cardizem or Diltiazem, it kind of works more on the heart and less on the vasodilatory effects, whereas some of our other medications that we have on our pharmacology manual, like verapamil, definitely works a little more on the hypotensive side. However, even though this medication doesn't work as strongly as some of the other calcium channel blockers on the vasodilation and hypotension, they do say that this medication kind of has a stronger effect the higher that blood pressure is. So the higher that blood pressure is, the more we can kind of expect it to drop from giving this medication on a single dose. When do we use this? So this is used for treatment of AFib and flutter for us when they get above 120 beats per minute. And you can also use it for refractory SVT. If we've tried vagals, we've tried adenosine, those don't work. We usually have an option for beta blockers or calcium channel blockers, and this is one of the medications that are used pretty commonly at that point. It's contraindicated, once again, in our high degree heart blocks. I feel like I've said this in a number of medication videos that we've done here. So typically second degree, third degree heart blocks. It also is contraindicated for sick sinus syndrome and acute MIs. And as well, it's one of those things we always throw in here. Wolff-Parkinson White is always kind of weird, where it's not always this absolute contraindication, but sometimes we have to call med control before we give that because it can certainly have some effects there. That medication, it kind of has its own unique thing where it just doesn't work well with a number of other meds. Some of the side effects of this is kind of like right in line with what we expect this to do and what we've already talked about. So we usually want this to hopefully kind of sometimes lower that heart rate and lower blood pressure a little bit. Well, we can go too far with it. So of course, some of the unintended side effects is having bradycardia or hypertension on the back end. And also this is a medication that kind of just can cause some other dysrhythmias. So our patients should always be on the cardiac monitor already, but it's one of those things that we want to continuously monitor so that these other things don't kind of crop up. The dose for this, it's a weight-based dose for adults. We don't have too many of those. And it's actually a little bit to remember compared to some of the other meds that we have. So for this, it's going to be 0.25 milligrams per kilogram, max of 20. We want to go ahead and this isn't a rapid push. This is one of those meds that we can bottom them out if we give it like a rapid IV push. So we need to give that over 5 minutes. And then our repeat for this is after 15 minutes, we can give 0.35 mg per kg for a max of 25.